Start.
Okay, Baba.
So we will discuss today some topics in pediatrics, which is very important for the NEET. So what are the different periods in neonate? Number one is neonate. Neonate period, birth to under 4 weeks. That is less than 28. Early neonate period, first week of life, that is less than 7 days. Late neonatal period, 7th day to 28th days, less than 28 days. Okay?
Right.
Now, what is perinatal period? Perinatal period is from 22nd week of gestation, that is more than 154 days, or weighing more than 500 gram at birth, to less than 7 days of life. Okay?
Right.
Okay. Now, first stool, that is meconium, is passed within 24 hours.
24 hours.
This is important.
Yes.
Okay. Now, some topics like erythema and broxicum. Erythema toxicum is nothing but papular rust on trunk and face. It appears on second day and third day and disappears spontaneously.
Right.
Now, what is pre-deciduous teeth? That is natal teeth. It is the supernumerary teeth in central incisor position. They are set before primary dentition.
Okay.
Number is Harlequin. Harlequin, Harlequin. Harlequin. Harlequin is color changes. Division of the body into longitudinal half, into red and pale halves. Okay?
Okay.
Now, let us come with primitive reflexes. Primitive reflexes, the reflexes present at birth and reflexes appears after birth. So, primitive reflex present at birth are rooting, sucking, swallowing reflex, crossed extensor reflex, Moro reflex,
Okay.
and asymmetrical tonic neck reflex. Asymmetrical tonic reflex and palmar grasp reflex. These are all present at birth. Okay?
Okay.
Now, appearing after birth is symmetrical tonic neck reflex. Before birth, asymmetrical, but after birth, symmetrical tonic neck reflex.
Yeah.
Parachute reflex and Landau reflex. 3 reflexes present after birth. Okay?
Okay.
Now, these reflexes disappear as the child grows, because these are all inhibited by frontal lobe as the child grows.
Okay.
Now, their age of appearance, rooting reflex, 34th week appearance and 4 months disappearance.
Okay.
Crossed extensor reflex, 28 weeks and it disappears 1 to 2 months.
1 to 2 months.
1 to 2 months. Now, asymmetrical tonic neck reflex, 35 weeks and it disappears 6 to 7 months. But symmetrical tonic neck reflex, this is very important because it appears after birth, 4 to 6 months appearance and 8 to 12 months disappearance.
Okay.
Okay?
Yes.
So these are all important. One is parachute reflex, which appears 8 to 9 months and persists throughout life. This is very important. Persists throughout life. So these are the some reflexes. Now let us see the developmental milestone. This is a very big topic one. So the important months we will discuss here. So number one is at the age of 3 months, neck or head holding. Okay? 4 months, bidextrous reach. Bidextrous. Bidextrous means reach for object with both hands. Both hands. Bidextrous. 4 months. But at the age of 6 months, there is unidextrous reach. Reach objects in one hand. So bidextrous both hand, 4 months,
Yes.
6 months, unidextrous reach. This is important.
Okay.
And he also sit in tripod fashion, sit with own support in at that of 6 months. Now, at 9 months, the baby can crowls, or there is immature pincer grafts, probes with forefinger hold bottle. Okay. Another important is at the age of 15 months. At the age of 15 months, you can use towers of 2 blocks.
Right.
15 months, towers of 2 blocks. Okay. And at the age of 18 months, he makes a tower of 3 blocks, 3 cubes. At the age of 2 years, he makes a tower of 6 cubes.
Right.
And at the age of 2 years, he can copy a horizontal line. This is important. 2 years, horizontal line.
Okay.
3 years, make a tower of 9 cubes and draw a circle.
Sure.
So 3 years, draw a circle. 4 years, draw a rectangle. And at the age of 5 years, draw a triangle. So triangle, rectangle, circle, and horizontal line. 4 parameters.
Okay.
So horizontal line, 2 years, 3 years circle, 4 years rectangle, and 5 years triangle. Question may be asked that patient can make a triangle at what age?
Child can make a, yes.
So it is 5 years. Okay. So this is important. Now regarding APGAR score, everybody knows APGAR score. One point to be highlighted that it is an objective method of evaluating newborn condition immediately after birth. So APGAR score is not used to guide the resuscitation, but change of score at sequential times after birth can reflect how well the baby is responding to resuscitation effort. It should be done every 5 minutes, 20 minutes. Okay.
Okay.
So there are 5 changes. It may not be discussed here. Now, age of bone. This is important. Age of bone. So to determine the skeletal age in infant between 3 to 9 months, X-ray shoulder is most helpful.
Okay.
At the age of 1 to 13 years, hands and wrist X-ray is important. And children below 12 to 14 years, X-ray elbow and hip are helpful.
Right.
Okay. Now another parameter, it may be asked that the height and weight of the baby. Now weight of the baby is double by the end of 5 months.
Okay.
But height at the age of 1 year, 50% rise, and double at 4 years height. Okay.
Okay. That.
5 years. Now one is upper limb and lower limb ratio. At the age of 7 years, upper limb and lower limb ratio will be 1:1. Barabar.
Okay.
At the age of 7 years. So another important point is craniosynostosis. What is craniosynostosis? Premature fusion of one or more cranial suture called craniostasis. Okay. According to this, there are different types of head position. Number 1 is dolichocephaly. In dolichocephaly, this is the most common type. Sagittal suture, there is premature fusion of sagittal suture. So, due to premature failure, different types of craniosynostosis occurs. So, one is dolichocephaly, most common type, sagittal suture, premature. Second is acrocephaly. Acrocephaly is corneal, sagittal, and lambdoid suture is not fused, premature fused. Okay. Another is brachycephaly. Brachycephaly is there is premature fusion of bilateral coronal suture. So these three are important. And the most severe form is oxycephaly. This is also known as tower head or steeple head. Here the coronal, sphenofrontal, and frontoethmoidal suture premature fusion occurs.
Okay.
Okay?
Okay.
Okay. Now, regarding different parameters, different instrument we can use. So, what is the instrument used for? Weight. So, weight for weighing machine.
Done.
For length, infantometer. Height, stadiometer. Head circumference, non-stretchable measuring tape. And for skin full thickness, Harpendence caliper.
Okay.
Okay. The hormone with a permissible action at the onset of puberty is leptin. Leptin hormone is very important.
Okay.
Now there is orchidometer. Orchidometer is what is orchidometer? It is the instrument for measuring the testicular development. Okay.
Right.
Okay. Now, another very important is prevention of hypothermia. Often, क्या होता है? Baby is suffering from hypothermia. So, there may be some cyanosis, respiratory distress. So, how we prevent this hypothermia? So, there is warm chain 10 steps. Warm chain 10 steps. All are 10. 10 steps मतलब warm the room, warm resuscitation, immediately drying, skin to skin contact, breastfeeding, all are 10. So all warm chain 10 steps. This is important for prevention of hypothermia.
Okay.
Now, neonatal respiratory distress syndrome. Neonatal respiratory distress syndrome is known as hyaline membrane disease. It is due to surfactant deficiency.
Right.
Now, surfactant production starts at 20 weeks of life and peaks at 35 weeks. So, this is important also. Now, how we assess the RDS? The severity of respiratory distress is assessed by two scores. One is Silverman-Anderson score for preterm baby, and Downey score for any gestational age. So there are so many scores, but these two scores you must know. Regarding neonatal sepsis, early onset neonatal sepsis and late onset neonatal sepsis. Early onset means it occurs within 72 hours.
Right.
And late more than 72 hours.
Done.
A causative organism for early onset is group B Streptococci E. coli. And in India, Klebsiella is most common. But in late onset, there is coagulase negative Staphylococcus, gram negative bacilli.
Okay.
So, in early onset, pneumonia is more common. There may be fulminant course with multi-system involvement. But in late onset, there is bacteremia and meningitis are more common. So there is a parameter known as sepsis screen. What is sepsis screen? Sepsis screen include usually two or more markers are considered significant. Number one, now total leukocyte count. Total leukocyte count of less than 5,000 per cubic millimeter or more than 20,000 per cubic millimeter. Okay?
Okay.
Number 1. Number 2, absolute neutrophil count less than 1800 per cubic millimeter. Immature to total polymer, IT ratio. This is important. IT ratio more than 0.2%. More than 0.2.
0.2.
Okay?
Right.
0.2. Micro ESR more than 15 millimeter in 1 hour. Platelets count less than 1 lakh, 1,50,000 per cubic millimeter. Okay?
Okay.
So this is important. Now, another condition is hypoxic ischemic encephalopathy.
Right. HIE.
HIE. Hypoxic ischemic encephalopathy. It is perinatal asphyxia. So, what are the guidelines of this hypoxic ischemic encephalopathy? So, there are so many conditions. There is so many staging. There is one staging is Sarnet staging. To assess Sarnet, SERNAT, Sarnet staging. So, Sarnet staging are nothing but there is grade 1, grade 2, grade 3. One is important that in grade 2, seizure is frequent. Seizure is very frequent.
Okay.
Another important is that infants of diabetic mother.
Right.
Infant of diabetic mother, congenital malformation, VSD is most common, and also transposition of great arteries and coarctation of aorta. And most specific one is sacral agenesis. That is caudal regression syndrome.
Caudal regression syndrome.
It is the most specific for the infant of diabetic mother. Okay?
Okay.
This is important. Now, let us come with neonatal jaundice. It is categorized at birth between 24 to 72 hours and more than 72 hours. At birth or within 24 hours is pathological jaundice.
Right.
Now, what are the causes? There are different causes like ABO, RH incompatibility, intravenous infection, torch infection, vitamin K excess, so many causes.
Right.
And one is Crigler-Najjar syndrome.
Crigler-Najjar syndrome. Right.
Now, between 24 or 72 hours, it is physiological jaundice. It may be infection, congenital or acquired from the mother, polycythemia, Kefal hematoma. So these are, and in gut obstruction like Hirschsprung disease. Hirschsprung disease, okay? A late onset, more than 72 hours, breastfeeding, breast milk, jaundice, hypothyroidism, all are the metabolic conditions, okay?
Okay.
Now, unconjugated, in unconjugated or indirect bilirubin, it is poorly water soluble.
Right.
But conjugated with glucuronic acid or direct bilirubin, it is water soluble. Okay?
Okay.
So water poorly soluble in unconjugated and soluble in conjugation. Now, conjugated hyperbilirubinemia. What is conjugated hyper? It is defined as more than 30% of total serum bilirubin. It is always pathological. Okay.
Yes.
Now, there are 4 conditions of inherited hyperbilirubinemia. Number is Gilbert syndrome, Crigler-Najjar syndrome, Rotor syndrome, and Dubin-Johnson syndrome. So, Gilbert syndrome is autosomal dominant. Here is unconjugation of the bilirubin, it is mild form. But in Crigler-Najjar syndrome, there are 2 types.
Hmm.
Type 1 autosomal recessive
Hmm.
and type 2 autosomal dominant.
Dominant.
It is also unconjugated, but it is severe form.
Hmm.
A Rotor and Dobie Johnson, they are rare.
Hmm.
There is conjugated hyperbilirubinemia.
ठीक.
Now, most important is that serum bilirubin decrease with phenobarbital.
Hmm.
So, Gilbert syndrome, 70% there is decrease in serum bilirubin in addition to phenobarbital. But in
Okay.
Kriegler-Najar, it is 1 to 0%.
All right. Hmm.
But in Kriegler-Najar 2, it is 77%.
Hmm.
So, why it is important? Because wherever there is unconjugation, there is more chance of kernicterus.
Connectors. Oh.
So, mortality due to kernicterus in Kriegler-Najar syndrome type 1 is
Hmm.
very high
Hmm.
because there is 0% conjugation.
Hmm.
But in Kriegler-Najar syndrome type 2, there is no kernicterus. These 2 points important. Now, how we treat hyperbilirubinemia?
Hmm.
2 things, pharmacological and phototherapy. In pharmacological, we use barbiturate, phenobarbital.
Yeah.
It induces UDPG transferase and enhanced conjugation of bilirubin. Okay.
Hmm.
Second is metalloporphyrin. Metalloporphyrin like tin, zinc, they decrease bilirubin formation
Hmm.
by inhibiting heme oxygenase. Heme oxygenase. Okay.
Right.
Now, phototherapy. Phototherapy is most important, most widely used. So, in phototherapy, how it works? It acts by converting unconjugated bilirubin into soluble isomer, and that can be excreted in urine and feces. Okay.
Hmm.
For this, we use blue-green light. Blue-green light at the length of 460 to 490 nanometer.
Hmm.
Now, what is the mechanism of phototherapy in this case? There is structural isomerization, main function, main mechanism.
Hmm.
Structural isomerization and photooxidation.
Hmm.
These two very important, you must remember.
Okay.
So this is important. Now,
Also,
the one thing.
Also in the treatment of hyperbilirubinemia, there is the concept of double volume exchange transfusion, DVET.
Oh, let's state. I'm coming to that. Indication for exchange blood transfusion in infant. Number was cord hemoglobin of 10 gram per deciliter or less. Cord bilirubin of 5 milligram per deciliter or more.
Hmm.
And cord blood PCB is less than 30. These are the indication of exchange blood transfusion.
Hmm.
So there are 3 conditions. Cord hemoglobin of 10 gram per deciliter or less. Cord bilirubin 5 milligram per deciliter or more, and cord blood PCB is less than 30. So there are 2 methods, SBET and DVET.
Oh, okay.
SBET, single volume exchange transfusion.
Hmm.
DVET, double volume exchange transfusion.
Hmm.
That is single volume 80 milliliter per kg,
Hmm.
and double volume is 160 milliliter per kg.
Okay.
So exchange transfusion.
Hmm.
Now, regarding Bart's trauma, caput succedaneum and Kippel hematoma.
Hmm.
The difference between, what is the difference between two? One is caput succedaneum present at birth.
Hmm.
It may extend over suture line
Hmm.
and disappear spontaneously within 24 hours. But in Kiffel hematoma, it's seen at 2 to 4 days old.
Hmm.
It limited by suture line, mainly hematoma.
Hmm.
It may absorb over 2 weeks to 3 months
Hmm.
and also can calcify.
Okay.
Now, coming to the cardiovascular system,
Hmm.
there is congenital heart disease.
Okay.
So,
We can
congenital,
do it in the next session also.
okay.
because as such, most of the neonatology is covered over here.
Okay.
And system-wise, we can do in a separate video. So we have discussed all the topics for today: a period of neonates, the reflexes, development milestone, APGAR score, age of newborn, height and weight of baby, then craniosynostosis, instrument,
Yeah.
the prevention of hypothermia, then neonatal RDS, the respiratory distress
Yeah.
syndrome. There are different
Okay.
types of parameters to determine the age, the neonatal sepsis, the sepsis screen, the hypoxic ischemic encephalopathy, the perinatal encephalopathy, third NAT staging,
Mm.
infants of diabetic mother, neonatal jaundice, all the syndromes, the Gilbert and all, treatment of hyperbilirubinemia, तो phototherapy, single volume exchange transfusion, double volume exchange transfusion, birth trauma. So overall, we have discussed all about neonatology. So
Neonatology.
can you tell me like how a student should uh, like prepare themselves for this exam? These are the important topics you have given. So
So this is important. What is the minor things? As for example, that at what age, what is the age, what is the time duration? You must remember. Suppose neonatal jaundice. Neonatal uh, jaundice appears at what time at birth and how it long it lasts.
hmm.
And this one is neonatal period,
Hmm.
one is perinatal
Interval,
period.
the time period, the
Time
nominal.
period is very important, and the doubling time, triplet time, quadruplet time of height and weight,
Hmm. Hmm.
and this milestone. Milestone is very important.
Right.
So milestone is not nobody can remember everything, but the most important was is that uh, uh, sometime I remember that in some AIMS exam or some there is a question that one is a triangle. Uh,
हाँ,
they draw a triangle and बोलेंगे at what period they can draw a triangle,
हाँ, हाँ,
rectangle, circle, or horizontal line.
हाँ,
Or they ask about that makes two blocks, tower of two blocks, makes a tower of three blocks, three cubes, six
हाँ,
cubes, nine cubes.
right,
Okay,
right.
so these two things important.
Hmm.
And these are different types of reflexes. Which
हाँ,
reflex start early, which reflex early, disappear early.
hmm.
These are all important. And which brain part is responsible for the reflection and vanishing of these reflexes.
Right.
And this regarding congenital heart disease, we will discuss tomorrow.
हाँ,
This is also very important.
right.
And the X-ray picture of this congenital heart disease
Hmm.
frequently asked that different types of X-ray picture in different diseases.
Okay. Okay.
So for the examinee, they should remember
Hmm.
and in quiet mind that exact time and date and exact age. This is important.
Okay.
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 So
So today we'll stop.
as a pediatrician, if someone wants to become a pediatrician, so what are the things like he should think? Like you can मतलब हिंदी में ही बोलते हैं हम लोग कि अगर कोई pediatrician बनना चाहता है तो उनमें क्या क्या क्वालिटीज दिखनी चाहिए लाइक एज सच प्रैक्टिस में आप भी बच्चे लोग को देखते हैं प्रैक्टिस करते हैं तो न्यूनेट का भी पेशेंट्स कभी कभी आ जाते होंगे तो व्हाट आर द थिंग्स विच आई थिंक उनको ये करना चाहिए लाइक प्रैक्टिस में रखना चाहिए वो क्या एक्सपेक्ट कर सकते हैं हेलो